I'm the co-founder and CEO of a company called Heal. We're at heal.com. I just want to clarify that. We started the company in October of 2014, and we do doctor house calls, right? Primarily, our focus has been since early 2015 to deliver doctor house calls to people. So actually sending a board-certified licensed medical doctor to your home, your living facility, your apartment, your job site, your workplace. We go on site of many large companies here in Southern California and in Northern California and deliver old-fashioned in-person care to people of all ages, from kids who are 2 weeks old to their great-grandparents who are 102 years old, and everybody in between. Now, we've always offered telehealth, or at least for the last couple of years we have, as a way to answer those simple questions for Heal patients. A doctor comes and sees you and says, hey, if that rash gets worse, call me in 2 days. Well, you think it gets worse, you want to call the doctor, they can use our system to telemedicine, but they've already seen you and they've already talked to you. Now, with the outbreak of COVID, about a month and a half ago, we started thinking in late February that, look, this is going to dramatically change the way care needs to be delivered, right? And this is at a time when outside of California, a lot of the government officials were still downplaying this, but we're a company of doctors. I'm not a doctor, I'm an engineer and the CEO, but my wife, who's our chief medical officer and our medical leadership, were like, this is going to change. So we brought our telemedicine to the forefront, and by middle of March, we said every first interaction with a patient has to do telemedicine first. And just to put in perspective, we did 20 times as many telemedicine visits in March of 2020 as we have ever done in a single month before that, right? That's the kind of growth we saw.
That's amazing.
Yeah. So now we are using house calls, continue to deliver house calls for patients who don't have COVID or at no risk for COVID, and from providers who we have provide the equipment to keep themselves and their patients safe. But we primarily are doing telehealth. Telehealth is when you use our platform which does not require download, but we do have an app if you want it, to speak and connect with a live board-certified doctor for yourself, for your kids, a pediatrician, for your parents, for your grandparents, and we do this in all of our markets. And the beauty of telemedicine, because it is something that does not require us to come to your house, we deliver it not just in our markets where we deliver house calls within California, but to all 40 million people in the entire state of California and to 7 other states totaling. Our telemedicine access is available to 100 million Americans right now.
That's amazing. So before a month ago, basically before COVID, BC, the way it worked is someone could download the app or go to the website, and then for how much money for a visit? How much money would it cost for a doctor to visit?
Yeah, so Dr. House Call. So our philosophy from day one has always been that Heal is concierge care for everybody, right? It's not a concierge price point. It's a concierge quality doctor that comes to your house, but it's not a concierge price point. We accept all major insurance plans from Medicare to Blue Shield of California, Aetna, Humana, Cigna, United Healthcare, Health Net, and all major insurance plans, Anthem. So if you use Heal for a house call, your copay will be the exact same copay that you pay when you go to a doctor's office for a primary care visit, which is typically between $5 and $30 with most insurance plans. Some are different, but typically with most insurance plans, between $5 and $30. But the important thing about that is that Heal's open 8 a.m. to 8 p.m., 7 days a week, 365 days a year. Whether it's Passover, which I think is right now, or Easter, which is Sunday, or July 4th, we're open, right? And so typically on those days or weekends, your option is not to see your doctor and pay your office copay, but your option is to go to an urgent care and pay a much higher copay at an urgent care or an emergency room. Whereas Heal is always a primary care copay, which is typically between $5 and $30. Sometimes it's nothing, depending on your insurance plan. With telemedicine, our copay is the same as your insurance plan telemedicine copay. Every insurance plan in America and Medicare have made the copay for telemedicine zero out of pocket during the time of COVID-19 to help people get telemedicine. And we've done the same so that you can get telemedicine for no copay with Heal.
Great. How long would it take in the old days? How long would it take for a doctor to come out? And what sort of visits could you do? or she do?
So what we have always done is said, we will get a doctor to you within 2 hours. Unless the market is unusually booked, there's something unusual that goes on, we'll always deliver same-day house calls, but typically within 2 hours. Now, except obviously, if you see a heel doctor, like I have a heel doctor for my children at home. She's a heel pediatrician named Esther Park. All of our scheduled care for our kids is with Dr. Esther Park. That is scheduled ahead of time because we want the same doctor. So you get the benefit of, hey, I want the same doctor, and I can see the same doctor by booking ahead of time. But the benefit on the other side of, hey, I want a house call and I need urgent care right now, well, I can get that doctor within 2 hours, right? And we're, again, open 12 hours a day, 7 days a week. With telemedicine, we're guaranteeing same-day availability. You can get an appointment within the same day, often as soon as 1 hour, right? So you can be talking to a doctor, it's 3:15, you can be talking to a doctor maybe by 3:45 and certainly by 4:15 today.
Great. So since you already had telehealth as a component of Heal, you didn't have to like entirely build new systems. It was just basically funneling all of your visits to your telehealth product. Is that right?
Yes, our vision of Heal has always been to make a user-friendly consumer experience, a consumer-grade consumer experience. There's a weird thing about healthcare in America, and I'm talking to the digital LA community, so you guys will all relate to this. If you use the Domino's app to order a pizza, or Amazon, or Netflix, or Uber, or any app you build, we expect it to be super easy, quick, intuitive, consumer grade, except when you try to go to a doctor. You just expect it's supposed to be a pain in the ass. I got to wait on hold. I got to talk to a person. I got to pay for parking. I got to wait in a dirty waiting room. I don't know if that person has COVID or not, whatever the case may be, right? Before COVID, we were afraid of unvaccinated people who had measles, right? You should never go to a dirty doctor's office, right? We've always designed Heal, whether it's on our website or our iPhone app or Android app, to be consumer grade. We said day one, I love pizza. You can probably tell by my extra chins here that I eat a lot of pizza, right? So
I just had
I've
pizza
always said it should be as easy to book a doctor as it is to get a pizza. And that's what we've tried. And our telemedicine experience is the same way. It takes less than a minute for a first-time user, less than 20 seconds for a repeat user to book a telemedicine visit on Heal. And we give you price transparency up front. We tell you how much it's going to cost up front, whether it's whatever your out-of-pocket is. So you never get a bill, an unpleasant, hey, we did all your care, but that $4.94 wasn't covered. And you're like, what was that for? I don't even know what the hell you're talking about, right? So that's what we have done with the Heal app and with the Heal website. An extremely intuitive, user-friendly experience that feels very comfortable and familiar to anyone who's used any state-of-the-art app like Uber or Domino's or Netflix or any of these companies.
Yeah, the healthcare industry has long needed something like this, just very user-friendly with the same sort of like ease of use as an app to get food to come to your house, or Uber or a Lyft. You can also get a doctor. Can you specify like, I don't know, the doctor's gender if you want to, or specialty or levels of experience, or how is that assigned?
So yes, you get to pick. You tell your doctor the symptoms you have, and you tell the doctor the kind of care you need, and we will then pick the right doctor for you. You don't get to specify gender. It's not a dating service, right? You don't get to specify the level of experience. We only put high-quality, board-certified, licensed, experienced doctors on the platform in the first place, right? What you can specify after the first time you have used Heal is that you want that doctor. I want Dr. Esther Park. I want Dr. David Dimitrioff. I want Dr. Justin Zaghi. These are real Heal doctor names, I'm saying. I want this doctor. Then you get scheduled care. That doctor might not be working today. They might be working tomorrow, so you may have to wait till tomorrow. But for scheduled care, that works very well. So you can set and say, I like this particular person, but you don't get to gender select, and there's no doctor on Heal that isn't an extremely high-quality provider.
Excellent. So once the coronavirus hit and you shifted all your activities to your telehealth product, how did you communicate what was going on to your consumers?
So we did a lot of things. We're doing press like this. There's been a lot of press about Heal recently, which we're very thankful for. We've had a lot of my wife was actually on Fox News, which is, I'm not going to, they did a great job and they're very fair to her. It's not the news program I watch most often, but whether it's that or CNN or Washington Post or CNBC, or we've had a lot of great press recently. We emailed all of our users. We took to social media. And we tried to educate users that this is available. We also trained our customer support team. Someone made a comment here in the comment line saying Red Baron. I actually love Red Baron frozen pizzas. I think it's better than getting delivery because the delivery pizza comes cold. My kids love grown to love Red Baron too. I have 3 kids and they all love pizza and they all love eating the cheese off pizza. So they're following in their dad's proud footsteps.
You can tell we're doing a panel right after lunch when we talk about pizza on the health panel. That's awesome. So, so as you're doing more telehealth all telehealth with a 20 times increase in your telehealth visits, or you call them visits? Is it a visit?
We call them appointments.
Appointments, okay. With
house calls are house calls, and these are telemedicine appointments.
Okay, with the appointments, what can people do as far as like COVID? Can you screen for COVID symptoms with a telehealth appointment? Yeah.
So to Tony, who posted the comment in the chat, I'll answer that right after I answer Kevin's question. But to answer your question, here's the thing about COVID. The symptoms are similar to flus and colds, but they're distinct enough that a doctor I'm not going to say, can guarantee whether you have COVID or not, right? But can tell with a pretty high degree of confidence, look, this is COVID or COVID-like. What are the telltale signs, right? Fever, shortness of breath, headache, right? But what is not a telltale sign? Sneezing and runny nose, that's a cold, right? I'm not a doctor, I'm not giving medical advice, but our doctors can tell before you ever get a test, right? Now, I think it's an incredible tragedy in America that testing is not readily available and has not been. California has done a phenomenal job, but as a country, we've failed when it comes to testing. I think we all know that, right? I think that is largely known, right? But what is true is that a doctor can talk to you before you get a test, before you have to go get the swab stuck in your nose and tell you, look, this is more than likely COVID. This is more than likely not COVID. Right? Because of the symptoms. Our own nanny a couple of weeks ago had a sore throat, okay, and a headache. Okay, those could be early symptoms of COVID. The heel doctor talked to her and said, look, I don't think this is COVID, but we're going to check on you tomorrow. By the next day, she had sneezing and a runny nose. Okay, that's a cough, right? So our doctor would schedule a follow-up. Now, if you need testing, someone asked if you need testing. So for COVID testing, we send you out to the appropriate testing facility. It used to be, because of the shortage of tests, we had to identify you as what's called a person under investigation, which is someone who we think has a high likelihood of risk factors for COVID. They weren't giving testing to everyone, even in California. Now, testing is widely available in California, so we can say, hey, you live in Santa Monica, there's a drive-by testing facility there.